Hello everybody, welcome back to my little YouTube channel. As you can see, I'm in my humble abode, I'm in my house today. Just because I woke up late today. I woke up at like 12:30 and I just can't be bothered because I'm just feeling a bit lazy today. And I'm a bit depressed because it's pancake day today and I didn't know it was pancake day. And I don't have any pancakes, so if anybody wants to come to my house and make me some pancakes, you're more than welcome. Or just leave them at my front door, please. Sugar and lemon I like. But I hope I've not got toothpaste around my mouth. I've just brushed my teeth and I've not even checked. If I have, I do apologise. I want to talk today about autism, coming back to basics, sort of starting again with my videos. I have got loads of videos on my on this DJI, which is what I'm recording on now. I've got loads of videos that I haven't yet had time to upload, so bear with me. But coming back to basics, I'm going to talk about autism. If you're new to this channel, my name's Amanda. I'm a diagnosed autistic adult. I was diagnosed a few years ago. The cats are play fighting in the background, so if you can hear meows and play fighting, they're not going at each other, they're just playing. Autism is a neurodevelopmental condition. That means that it's a genetic condition. We're born with it. I was born with autism. When I was younger, I was talking to my dad the other day, and he was telling me that when I was younger, I used to do unusual things. I had unusual behaviours and unusual patterns of behaviour that at the time, because I was born in the 1980s and I grew up in the 1990s, autism sort of wasn't recognised that then for females. It was more sort of predominantly, like a male condition. And so these behaviours that I had wasn't attributed at the time to autism, which is interesting talking to my dad the other day. And I'll go into that about on another video because I think it's quite interesting about some of the things that I used to do as a child and as a baby indeed. But obviously autism, as it's genetic, I've had it all my life, from a baby into adolescence, adulthood, and I'll have it into old age and I'll essentially pass with it. And that's what autism is. There's no cure for it. There's no one pill cures all to autism. There's no vaccine for autism. You can't get rid of autism. It's why would you want to? Why would you want to? I mean, autism has its positive things and it has its not so positive things, but at the end of the day it makes us who we are as human beings, and we're unique. It makes us unique, and so why would you want to get rid of autism? So usually it's passed on by the genetic line. We think my dad has autism. My dad's doctor has told him that he highly suspects he's autistic, and so that's why when my dad spoke to his doctor and said that my daughter's autistic, his doctor said, well, actually we think you might be autistic. My dad didn't want to go for an assessment, but we think that my dad has passed it to me, which is fair enough, fair play. So some of the different, I've got some notes here, so bear with me. So some of the different signs of autism as it presents is a difficulty in understanding others. That can really affect autistic people. It can affect us in employment, it can affect relationships, and it can affect friendships. It can lead to breakdowns in communication. Sometimes we can say things that we don't mean. I can misinterpret others. Sometimes other people can misinterpret what I've said, and it can lead to like this disconnect in communication and this breakdown in friendships and family relationships and in general relationships. We can get really anxious in social situations, and a lot of that is due to the communication barriers that we face. Also, we have real struggles with the sensory side of things. So as you can see the bright light behind me outside, when we leave our house, we're met with loud noises, we're met with bright lights, flashing lights sometimes, sirens from police cars and ambulances, people bumping into us, having to make small talk and interact with people, and all of this can lead to sensory overload, and it can be too much. So it can lead to anxiety, heightened anxiety, and sometimes we can get panic attacks, and sometimes the anxiety can be so much that we don't leave our house, and that often happens to me. It happened to me last week where I didn't leave my house all week. I didn't answer my door all week, for you guys know what reason, but because my anxiety was so high, it affects us in different ways. Autism is a spectrum. A lot of anxiety that we have are related to different things, relating to how we cope with our own condition and how we perceive our surroundings. And so it can really be detrimental to our mental and physical health. And as a result of that, a lot of us, we can find it really difficult to make friends, to socialise, and so we prefer solitude. I describe other people a bit like energy vampires, and I do it myself. My cat's play fighting in the background there. I do it myself, when we offload to people or when people offload to us, it saps your energy. And autistic people, I think we tend to feel that reduction in energy, that depletion in energy, like somebody's literally sapping energy from us. It's like an energy vampire. And so we prefer solitude. We prefer to spend time on our own, to rest on our own, to not have to make small talk, to not have to listen to other people going on and on and on in conversation, because it can be just mentally and physically draining. And sometimes we can come across as being very blunt or very rude when we don't mean to. I oftentimes, when my dad will phone me, because I don't speak to other people on the phone, and as much as people might think you seem okay on the phone or you seem okay speaking to people, it's because I'm masking, it's because I'm putting on an act, and I do it incredibly well, so well, that people assume that I'm okay to do these things. But I've often said to my dad when he phones me, and sometimes he'll say the same thing over and over again, when people phone you and they'll grandmas and granddads do it, don't they? He said this and I said this to them, and then they replied this back to me, so I said this back to them, and they did this, and that's it. And sometimes I just think, I don't want to know, or you've told me that and you've repeated it a few times, and so I can say, actually, I'm tired of this conversation now, and I'll put a stop to it. And that can come across as really rude or passive aggressive or whatever to the other person, and that can isolate us and make it can be really misunderstood as a result of that. Another sign of autism is this fondness for routine and ritual. I need that in every single area of my life. I have to have routine and ritual. Everything has to be pre-planned out. There are days when I miss work because I'm anxious, and I won't tell anybody about it. But the beauty of that is that all my patients know me. They know that I've got autism. They know that I have anxiety. They know that I have days where sometimes I just need to spend time on my own. And you know what? They're such beautiful people. They don't judge me. And that's why I love working on my own in private practice as opposed to like the NHS, because you get to know your patients as long as you're open and honest with people and you explain your problems and people understand. It works out really well. But routine and ritual is really important for me in work. When I worked in the National Health Service, routine and ritual often changed, and that was really triggering for me. And in every single area of my life, I like to have things pre-planned out, knowing where I'm going. My dad has to tell me if we're going to the shops, if we're going to food shopping, for example. We have to have that pre-planned out. We have to have the time planned out, the day planned out. Roadworks can really throw me off if there's roadworks. My dad took me out on a whim on Sunday, which didn't go down too well. He just turned up at like 6 a.m. But he dragged me out like kicking and screaming. I actually took some sedation before that, so I wasn't too bad, which obviously you can't do if you're working. You can't take sedation to go to work. But there was roadworks, and that just sort of topped it off a little bit. I was okay because I was sedated, but things like that, the unexpected changes to our routine and ritual, things that happen that we don't anticipate for, can really throw autistic people off, and it can lead to shutdown, it can lead to meltdown, it can lead to heightened stress and anxiety. We can really find it difficult to know what to talk about in conversation with other people. So say, for example, I went on a train trip somewhere, which I would never do. I would never take public transport. That's why I have my own car. But it's happened in the past before. Years ago, you take public transport, there was this group of lads, 3 lads, trying to make conversation with me, and I was on my own. They were nice people, but because I have autism, having to make small talk with people was just really difficult. So I would just sit there and just wouldn't say anything at all, and people just think that there's something strange or there's something not quite right there. So that can really isolate us from other people. If you go to a party, which I did years ago before I was diagnosed with autism, and I would just sit at the back on my own and I'd just pet the cat at the party and just avoid all the people. People would isolate you and not invite you to other parties because you're not part of the clique, you know, the inner circle. So finding it hard to initiate conversation, know what to say. Where interrupting people can be really difficult as well. Knowing when to stop talking. Special interests can be a big one. We can talk and talk and talk about our special interests for long periods of time. Again, that can isolate us from other people, you know. A big one for me is avoiding eye contact. I'll do it. I'll make eye contact with people and I'll talk to people and I'll smile like I'm talking to you, and I'll tell you that you look beautiful. I'll tell you that you're a nice person, that you dress really well, that, you know, I'll shake your hands, I'll hug you, whatever. Doesn't mean to say that I enjoy doing any of these things. What it does mean to say is that I'm a very good actor, and I'm very good at pretending to be a person that I'm not, but it can be really convincing to other people. So when I make eye contact with people, it's really stressful for me, it's really straining for me. Sometimes if I'm feeling really anxious on a particular day, eye contact can be just even more difficult for me at that particular time, and so you'll find me looking away or looking down or looking back up again. But if I do make eye contact with you, don't assume that I'm okay, I'm functioning. It just means to say that I'm just incredibly good at acting. And the same goes for hugging as well, and close contact. Special interests, a lot of us can have obsessions and compulsions, and that can manifest in our special interest. A lot of us have, which is really fundamental to our health and well-being. A lot of us have special interests with autism. I know I have lots of special interests, and sometimes they can change over time. One or two I've had for a long period of time. Sometimes we can get a little bit obsessed with those. Some of the signs of autism in women are, as I've come back to what I've saying about making eye contact, hugging, speaking, making small talk, is masking, and that is camouflaging or hiding our autistic traits. And that can be really challenging for other people that are close to us, even other autistic people themselves. Maybe autistic people that struggle to mask and that struggle to have relationships, that struggle to have friendships, that struggle to make small talk, that struggle with communication. When an autistic person like that meets somebody that's incredibly good at acting, it can really challenge their thoughts around whether that person is indeed autistic or whether they do indeed struggle. And actually, yes, and even for healthcare practitioners and doctors and nurses, just because an autistic female is talking to you, making eye contact, maybe hug you, shake your hand, tell you what you want to know, answer questions because they've probably pre-scripted them in advance before they've come to see you in an appointment, for instance, it doesn't mean to say that autistic person is functioning. It's probably likely, if it's a female, that they are just very, very good at acting and masking, and I'm extremely good at putting on an act or a role. I think actually I would probably be really good if I could turn time back. I would have gone into what was it called when you was learning and you wanted to go into acting when you was younger? I can't remember what it was called now. There was a specific class that you'd enroll into, and it would teach you go on stage, and I used to really enjoy that because when I went on stage I was putting on this persona of somebody else and I was no longer me, and so I was able to do that. If I could turn time back, I would go back to that, and I would have probably gone into acting. It's just such a shame that it's got to the point where I'm an adult now and I'm probably too old to do anything like that. But if I could do a job in acting, I'd probably be really successful at it, because I could just put on an act like that and no one would be any of the wiser, because I'm literally pretending to be somebody I'm not. The same as when the pandemic was in full force, I used to love wearing a mask, not because it protected me from a virus or whatever, because I felt like I was covering up my identity, and I felt like when I was wearing a mask I was somebody else. I was able to be somebody else, and for many reasons I wish it had come back, just so I can wear a mask again and not be looked at strange by other people. The same with acting, the same as when I make small talk and conversation with people. It would be ideal for me to work in television and just pretend to be somebody I'm not, because it's something that I succeed in every single day of my life. I don't fail in it, I succeed in it. And a lot of autistic females do as well. Unfortunately, we can be quiet to professionals, to doctors and nurses. We can avoid appointments. We can avoid telling people how we feel for fear that we're going to be judged, for fear that we're going to be misunderstood. There's a lot of unfortunately, there's a lot of misunderstanding surrounding autism. There's a lot of people that don't understand autism, and so we tend to be not supported as well as what probably we should be in the health service, and so it can put us off telling doctors and nurses our true feelings and or just avoiding appointments altogether. And coming on from that, we can appear to cope really well when indeed we're not coping well. And it can be hard to tell then, looking at me now in this video, if you're a doctor or a nurse, or if you knew me and you'd seen in my previous videos of me struggling, and then you watch this now, I can understand how difficult it would be for somebody to wonder why that person has flipped from that challenging behaviour to this seemingly okay functioning persona. And it can almost come across as like almost like a bipolar disorder, this up and this down, this high and this low, this elation and this depression. Or it can come across as like almost like a split personality disorder. There's all sorts of different things that we can be misdiagnosed with in medicine, because it can be really difficult for mental health professionals and psychologists and psychiatrists, family, friends, relationships, loved ones, to look at us one day and see us that we're not functioning, and then see us like this now on another day and see that we seemingly are okay. And it can look like we're either faking it or that we have another mental health condition unrelated to autism, when indeed, especially if you're female, a lot of the time it's just that we're putting on an act, we're putting on a smile. The same as what I said, I could work really well, I would succeed working full time in an acting profession, because I'm literally just putting on a persona. So what should you do if you think that you are autistic? So the first thing that I did, because I watched a documentary on BBC News, and it was this girl that had autism, and I said to my dad, we happened to be in the kitchen at the time, I said, you know what, that sounds like me. Everything she's just described, like I've just described there on this video, I fit the bill. It fits me, it fits my personality. My dad sat down with me and he said, right, let's make an appointment, let's go and see your doctor. So that's what we did. So if you think that you are autistic and you can recognise some of the signs and symptoms of autism that I've just described in this video, this short video, it's worthwhile talking first to your family and friends if you feel you can. If not, go and see your doctor, or just mention it at your next appointment to your healthcare provider, and then they can do they'll probably actually either do what's known as an autism quotient questionnaire, or they'll advise you to have a look on Google, and you can see, or you can do it yourself now, you don't even have to go to the doctor. Have a look on Google, type in am I autistic /autism quotient questionnaire. You can fill in this questionnaire, fill in one that's free. It's usually about 20-25 questions or thereabouts, and it asks you things like do you like eye contact, do you get anxious in social situations, do you prefer to be alone, or do you prefer to be around other people. It asks you all sorts of different questions, and if you score highly enough, it will tell you at the bottom of your results. You shouldn't have to pay for the results. If you have to pay for them, go on one that's free. I went on one that's free. There's plenty out there that's free. You shouldn't have to pay. But at the end of the questionnaire, it will tell you whether you do or you don't score highly for autism. Take that information to your doctor, present it to your doctor, and then the doctor can get the ball rolling with regards to an autism referral. They'll then refer you to an autism department. Sometimes the waiting list can be a long time in the UK. Whether you choose to go privately or NHS, that's entirely up to you. I waited over 3 years for an NHS assessment. Just because at the time I worked in the health service and there was just so much going on, and I just didn't have time or space or energy to go private, and I just waited it out. So the healthcare assessor, the doctor, will get you referred to an autism assessment, and then you can go and get the ball rolling and get your autism assessment diagnosis if it is indeed autism. So that's the first thing that you should do. I hope you guys have enjoyed this video. If you have, please consider hitting like, commenting and subscribing, and I shall see you next time for another video.